Welcome to our daily show, Afya Yetu. I'm Collins Dhoe, and today we'll be talking about hypertension in pregnancy, what leads to hypertension in pregnancy, and other conditions related to it. With me, I have Dr. Salvan. Dr. Salvan will introduce himself and tell us more about what he's doing, what he's planning to do, and any event which is coming in very soon.
Good morning, our esteemed viewers. It's another good Friday to be with you today. Yes, as you said, I'm Dr. Kengo Salvan. I work in Nakuru. I'm also the co-founder, Secretary General of a CBO by the name Victoria Medics Empowerment. Actually, it's the shirt I'm donning here. It's called Vimeo. We do community health promotion, community health empowerment, where we organize outreach activities to teach matters health and generally spread awareness about common conditions, teach reproductive health rights, all that. Yes, and I'm very proud today to be Dr. Collins as we delve deep, demystify all the myths about hypertension in pregnancy and teach people about the common things that we can know about these things when they arise. Thank you.
Okay, just to start us off, we know hypertension is a condition where the blood pressure increases, and there are some things which leads to increase in blood pressure. So maybe, Doc, we can start maybe generally by defining what is hypertension. Yeah. High blood pressure.
Asante sana, Doc. Usually there's the common term that they use wakisema unanipea pressure. Sema usinikule kichwa unanipea pressure. There's the definition of hypertension hapo nje, and of course then there's the medical definition of hypertension, right? Yeah, so the medical definition of hypertension varies really depending on the condition we're talking about. We have the definition in pregnancy, and then now we have the normal definition when it comes to these other conditions. Somebody who just walks into a hospital, akapima blood pressure, alafu tukapata imeenda juu, ndio?
Yes.
Yeah, I think talking of the definition, I would go with what you have in the Gen C9 guidelines, where they are further divided into, you have hypertension, you have pre-hypertension, then finally you have what you'd classify as hypertension. So blood pressure of 120/80 usually is considered normal blood pressure. Now in the normal classification, in the current classification of Gen C9, a blood pressure of systolic 130/80 still, that is 80 to 89, is considered pre-hypertensive. Yeah, pre-hypertensive means huyu ni mtu anaweza kuwa na hypertension. We need to watch some factors ndo asikuwe nayo. But still, we can't label him or her as hypertensive. Now, blood pressure of 140/90 is what now is considered now as hypertension. Yes, and the full definition usually goes, it's a blood pressure of 140/90 taken at least 4 hours apart.
Yeah.
In more than 2 readings.
In more than 2 readings.
Yes.
Sure, Doc. But now, maybe, I don't know, because you get that this blood pressure, at time you get that it increases with age. Would you say that maybe somebody who is 60 and not 60, maybe 70, and has a blood pressure of 140/90 is hypertensive?
Really, just the way I said, there are a lot of variations depending on age, pregnancy, and in this I would want us to focus more on the pregnancy bit. Yeah, when it comes to pregnancy, really, there are a lot of factors that can predispose one to having hypertension in pregnancy. And one of the things that I want to highlight, not having hypertension before pregnancy does not mean that automatically you will not have it while you're pregnant. But another contrasting funny thing ni having hypertension pre-pregnancy instead is a very high risk or a high predisposition factor to having hypertension now during pregnancy. Yes. The terms in pregnancy are a little bit varied. We have what we call gestational hypertension. You have chronic hypertension. Now we have an hypertension that is complicated, what referred to as preeclampsia. Then preeclampsia, when it further complicates, now we refer to it as eclampsia. Yes. Really, but the main thing for our pregnant mothers or mothers who are planning to get pregnant, especially when they've been diagnosed with hypertension before, we need to do thorough follow-up, thorough screening before we get pregnant. And we need to do adequate monitoring and maintenance of their BP so that by the time at least wanaenda kupata ile mimba, the BPs are properly controlled. Then such kind of pregnancies, we do call them high-risk pregnancy. Simply means that this is the kind of pregnancy whereby if not well taken care of, you might have adverse outcomes. So that said, we usually encourage a lot for this kind of pregnancies that we don't miss our antenatal visits. Actually, if possible, we should even start going to the hospital, to the clinic for proper advice in the planning period. But unajua sasa kwa setup yetu, unajua majuu kuna ile planning period ya kupata mimba. Then now you go ahead and
I think what Doc is trying to pass out there is that before anybody gets pregnant, kindly visit your hospital, visit your gyna, visit your medical personnel, just to do the normal screening. Let your pressure be taken, let your blood sugar be taken, let your weight be taken, do simple urinalysis, do this simple screening. It goes a long way, because let's say maybe you had maybe impending condition and then you get pregnant and this condition is not taken care of. It will escalate during pregnancy. And I think that's the message you are trying to emphasize, that according to maybe the World WHO, it's highly recommended that before you get pregnant, you do something called, normally it's called
You're talking about the antenatal profile?
Yeah.
Or the preconception planning?
Preconception visit. That's the word, yeah. So, Doc, maybe if you can just tell us maybe some of the risk factors to hypertension in pregnancy. Some of the risk factors, maybe if this lady maybe had some previous hypertension in pregnancy, if she had maybe renal condition and things like that, if those things can predispose her to getting high blood pressure during pregnancy.
Thank you, Sana Daktari. With the risk factors, we say at least they help us predict whether one will have this condition during pregnancy or not. But really, the first thing I want to make clear is it's always not 100% predictability. So there are situations or conditions that really can make us suspect that this person might have hypertension during pregnancy. The first one, just from the simplest of things, it's the common risk factors for hypertension, even in an unpregnant person. That is the normal things like an obese person, obesity, weight imeenda sana, tunachezea BMI ya 30 and above, smoking, hyperlipidemia, alcohol intake, the normal risk factors that cuts across all the population, that is whether pregnant or non-pregnant. Then when it comes now to pregnancy, some of the major risk factors that play a role in family history is key. Yeah, actually they say if you happen to be born while if you happen to be born while the mother was preeclamptic or while the mother had high blood pressure,
the mother to now the expectant,
the mother now to the expectant lady,
yes,
there are very high chances that the daughter now
will
definitely have, okay, not definitely, the daughter will probably have preeclampsia too. So family history is a very strong risk factor.
Yeah.
If one of the family members, the sister or the mother, happen to have got this during the pregnancy, it's of very much importance that we take great care before the daughter now finally gets pregnant.
Yeah.
Another commonest risk factor is a previous history. If during the first pregnancy, the first child, mambo ya pressure ilisumbua sana, you need to mention it, na hata kabla u plan for the next pregnancy, uende hosi to your gyne, to your nearest clinic, explain to them that mimi now during the past pregnancy, pressure ilisumbua sana. There's a very high likelihood that during the subsequent one, inaenda kusumbua, inaenda kusumbua tena. Then there's some literature that says that advanced maternal age.
Yeah, advanced maternal age and nulliparity.
Yes, advanced maternal age and nulliparity both play a certain level of percentage in predicting the risk factor of hypertension during pregnancy. Oh, by nulliparity tunamaanisha mwenye hajawahi kuwa na mimba anakuwa nayo for the first time. And advanced maternal age ni miaka imesonga. Of which I would need to be specific. Miaka imesonga ni gani?
35 years.
When talking matters pregnancy, 35 medically ndo tunatumia kusema miaka imesonga sana. Actually, the interesting thing ni past 35 years of age, we start calling that pregnancy a high risk pregnancy. Meaning ni pregnancy ingine we might expect
problems
were not taken care of.
But not always that any lady any lady with advanced age will get complications, but it's a risk factor of getting these complications. Or more so if you are 35 and you are getting your first child. That's when these complications starts. But it's not always the case that if you are getting late and you get pregnant, you'll get complications. It's not always.
That is true, dog. It's not absolute.
Yeah.
Sema ati juu sasa umeshika 37, huyu mtoto lazima sijui akue vipi, usijini. Medically, we give these terms so that at least to the population you can communicate the message that this is the kind of pregnancy and you can't miss going to your clinics.
Yeah.
We need to be extra careful with it. We don't take chances. We ensure everything iko
sambamba.
Iko sambamba.
I think that's what needs to go out there. But we highly advise that you get your baby, the earlier the better. Or more so, according to WHO, they recommend that the reproductive years is between 15 to 39 years. But yes, 15 to 39. That's the reproductive years. But now,
you're on air encouraging 15-year-olds
not to get pregnant, but those are the reproductive years. So it's 15 to 39, but now a lady like the pelvis, whatever, gets mature at around 24, let's say 21. So the most appropriate age to get pregnant is between 21 to 32 years. I think that's when now the eggs are so mature, and at that age also you are likely to produce an intelligent baby. They say that because that's when you are getting your most Dr. Non normally say your eggs are
at their prime.
Your eggs are at their prime, yeah.
Very true, Doctor. But on the intelligence part, I wouldn't want to weigh on that. Don't quote me on that.
Okay. but that's true.
That is what he said,
Yeah.
but I don't know if the literature confirms it.
So just to highlight on other risk factors, like if you have multiple gestation, you're having a twin, you are at a risk of developing high blood pressure in pregnancy. If you're having renal condition, kidney, shida za figo, you can also develop this high blood pressure in pregnancy. If you have chronic hypertension, as in uko na high blood pressure before you get pregnant, you are likely to develop high blood pressure in pregnancy. And maybe if you have anomalies like things like mtoto akuna shida like congenital anomalies, you are likely to develop high blood pressure in pregnancy. Ama vipi daktari?
Yeah, sure, I agree with you. They're what we medically in a nice way we call them comorbidities. Yeah, really they play a huge role in influencing whether or not you might have more complications during pregnancy.
Yeah.
Yes.
So I don't know kama daktari unaweza tuelezea kinaga ubaga Kiswahili si mdomo chetu. Kama unaweza tuelezea like how does this high blood pressure in pregnancy comes about? Like nini inafanyika then sasa uanze kukua na high blood pressure in pregnancy?
That time I told you ukianza Kiswahili the Luya in you comes out. Kuna Luya fulani umefichika yenye natoka. You know, people actually think Coastarians are the most fluent people.
Yeah.
When it comes to Kiswahili.
Yeah, sure.
But Waluya huku nje wanatuangeko Kiswahili yani anakutolea msamiati ingine out of nowhere yenye
unashangaa.
Yes, okay. The exact mechanism that gives us hypertension in pregnancy, majorly, last time there's something I said, that the basics in pregnancy, huku nje wanasemanga a pregnant woman ni watu wawili. Sindio?
Yeah.
Amebeba watu wawili. And using that line of thought, a pregnant woman being watu wawili, food anakula ni ya?
Yeah,
watu wawili.
Yes.
Venye mwili likina function before, sasa it has to adjust ianze kufunctionia
two people.
Watu wawili. Sindio? So the body has to create a favorable mechanism on how they can, on how the baby inside can adapt, and still how the baby inside can be well fed. Sindio?
Yeah.
So in that process, one of the things that happens is you have to increase blood supply around the uterine region. Sindio?
Yes.
Ule mtoto wako pale na venye anapata chakula, venye anatoa waste yake, it's blood supply from the mother to the baby. Sindio? Yeah. So, tunasemanga when pregnancy comes, the uterus increases in size. Inakuwa kubwa sana. With that increase in size, it has to increase its blood supply.
Yeah.
By creating new vessels. Hiyo tunaitanga angiogenesis. So these new vessels now zinafaa kuwa zinakreatiwa na we push blood through them ndo supply the whole of this region, the uterus, and by extension all the way to the baby. Sindio? So the problem now that usually comes, the spiral arteries of the uterus sasa. Unapata kuna mali, they are not that elastic. In some people now are predisposed to this hypertension, the endothelial walls that these vessels, unapata, we are trying to perfuse them zikuwe kubwa, but instead either we have endothelial dysfunction, ama the vessels zimekuwa tortuous. They are not getting
enough blood.
They are not expanding as you want them to expand.
Yeah.
So damu na itakuja, yes, lakini zikifika pale ina. So na imagine imekam lakini
there's obstruction or there's kinking. There's no clear flow.
Exactly, literally. So when that happens, tutakuwa na build up of pressure, literally. Yeah, so this is one of the major risk factors when it comes to BP in pregnant women that contributes to high blood pressure. But really there are other factors that we just talked about that can be outside pregnancy. But this is
outside the placenta.
Yes, outside the placenta. The other risk factors we talked about: smoking, alcohol intake, obesity. One of the commonest things with all those things we talked about, they're going to cause distractions in the endothelial wall of blood vessels. Now when that happens, you have the position of those plaques, the too fatty material, looking at a form plus fat plus, then you're looking at what we call atherosclerotic plaques. So hizo vitu zikianza ku deposit kwa walls, they decrease the size of the vessels. Diameter ina reduce chini zaidi. Na kama damu ilikuwa inapita kwa nini iko hivi, umekaforce kapita hapa. Si unaona umekaforce kapita at a very high pressure now compared to when ilikuwa inapita the vessels ikiwa hivi. So those other risk factors are still constant at a pregnancy ikikuja into the picture. Yes,
I think explain vizuri sana na our viewers. I know you know somebody who has suffered this condition. Umeenda wasi umeambiwa ati uko na blood pressure na uko na mimba, then ukaexplainiwa hivi ndio venyewe inafanyika. I think daktari explain vizuri sana na and maybe if you're a viewer and you're joining us for the first time, today we are talking about high blood pressure in pregnancy, some of the causes and where you can get help and what to look out for. So you get that this high blood pressure normally comes with a lot of complications, daktari. Unapata hata inaweza changia mtu kupoteza hiyo mimba yenyewe. And at this point maybe I want you to highlight on some of the issues, some of the complications zenye inaweza sababishwa na hiyo ugonjwa na how we can prevent those complications. Yes.
Asante sana daktari. Actually that should be the main message that we send out there, so that people can be well aware of the impact or the effect of these conditions in pregnancy, the effect of failing to address them that is going to your hospital, and what they can finally lead to. Sindio? So we actually say that one of the major causes of perinatal mortality, by perinatal mortality I mean deaths that occur around pregnancy. That can be either maternal ama fetal, ya mtoto ama ya madhe. So deaths that occur around that pregnancy period, hapo time ya kuzaa, na generally while during the gestational period, hypertension, especially the untreated one, is one of the major causes easy deaths. So one of the complications that can arise is we can have fetal loss. Mtoi anaweza pass. When we said, unaona, the whole thing is that we might have a problem with perfusion to the uterine vessels. By extension, we might have a problem now. Perfusion to the baby, that is delivery of nutrients, oxygen, and even removal of waste from the baby back to the mother. So when you have a compromise of blood supply to that region, we can actually lose the baby. That is one of the major ones, the major complication that can arise from hypertension. If you don't lose the baby, and I insist, we are talking about the unaddressed hypertension, the uncontrolled one. Umekataa kwenda hosi clinic, ukienda leo, the next time unataka kwenda ile unazaa. Another thing, when you compromise blood supply to this region, kuna zingine inaweza fika but isifike to the full amount. Na tumesema sini damu inapea mtoto the blood and the oxygen. That's what makes the baby grow. When that is compromised tena, tunaweza kuwa na mtoto mdogo, the growth of the baby might be restricted.
Compromised.
IUGR.
Yeah.
Intrauterine growth. Yeah. So unaweza pata umeenda hapo umezaa mtoto wako ako underweight, hakugrow vizuri kwa zile blood alikuwa anapata pale ndani haikufika venye inafaa ifike. Another common complication again that we get now on the fetal side, on the maternal side I mean, still we can have maternal loss.
Yes.
Then still on the maternal side, due to the high BPs, we are at risk of
getting eclampsia,
a lot of bleeding during pregnancy, what we call PPH, postpartum hemorrhage.
Yeah.
This is another key problem. It's a key problem that we not want to get to during pregnancy. So if there are ways that we can prevent it before it occurs, the better. But a lot of bleeding during maternal delivery is a complication that can worsen a lot of things in a very short time. Yeah, still on the mother side, just the way you've said, hypertension can again complicate and affect other organs now. The kidneys now, the proteins can start getting in the kidneys. The liver must start having pain on the right upper side, headaches, photophobia. Photophobia ni ile utaki kuangalia light ama blurring vision. Ukiangalia macho the common term ni macho inaona maruerue.
Maruerue. Hiyo sijasikia.
I know how we say it best in our mother tongue, but generally your vision is being blurred. Yeah, so when it gets to the point where by now our hypertension now has affected these other organs, now this is why we start calling it now preeclampsia, which is even more life-threatening. Because when it affects more organs, it means you're at risk of multiple organ damage.
Yeah.
So unless arrested early, this can give us some more serious life-threatening conditions. Still, preeclampsia can further complicate. Ikuwe mbaya zaidi sasa mali tumeanza kuwa na convulsions.
Yeah.
Where now we call it eclampsia. So inaweza fika pressure mali umeanza kusikia hizo uchungu za huku, headache, macho. Kama umekaa tu nyumbani tena haijakuwa addressed, inaweza fika mahali sasa ameanza kupata convulsions in Kiswahili. The lawyer in me is letting me down. Kifafa. Yes. Inaweza pata imefika mahali sasa hadi mtu ameanza kuanguka, umeanza kupata kifafa. As we build up, these conditions become more life-threatening, and there are very high chances of losing either the baby or the mother. So what is the message? When you have all those risk factors that you've talked about, kindly make sure that we do preconception planning. If you have hypertension before pregnancy, enda clinic yako, discuss even na mtu wako huko, waambie pressure yangu imekuanga hivi, this is how it is. Actually, I'm very impressed because people actually have their BP machines at home.
Yeah.
Na hadi yako na kitabu yenye ameandika. So akikuja hospitali anaweza sema confidently, mimi hiyo ndo pressure yangu imekuwa in the last 1 or 2 months or 2 weeks. So na hizi ndo madawa na meza. Kwa tena kuna zile madawa kama ulikuwa unatumia before you get pregnant, ukishakuwa pregnant we switch from them. Yes, because they might have some harmful effects to the baby. So mtu anakuja na kitu iko very detailed vizuri. Unaangalia, you advise properly, na hata unamcancel on the next subsequent visits zinafaa kuwa aje, and how we can adequately control this hypertension. So preconception planning. If you have hypertension before, if you have these risk factors, kindly make sure that naangalia kabla tupate mimba, umeenda OC ukadiscuss na daktari wako whether it's safe, whether it's okay to proceed with the pregnancy. Then sasa ndo hiyo ushapata mimba. Ile tulikuwa tunaangalia before, tumeconceive sasa. Tushapata mimba, ukaenda ukapimwa urine ama ukafanya ultrasound, tukaona indeed you are pregnant. antenatal clinics will help us in early detection of these conditions and even help us in mitigating them. Usikose kwenda kliniki venye imeadvisiwa. Once you find that we have these conditions, ensure that you go to the clinic as many times as you are told. Usianza kusema mbona zangu ni mingi kushinda za nani? Si nani alikuanga tu na mimba hapa na alienda tu mara 2 3 na si huyu mtoto ni mkubwa siku hizi anacheza. Hapana. Just go to the clinic as many times as advised. It's indeed true that with such conditions, your number of visits to the clinic zitaongezeka. And finally now, as the pregnancy progresses, unafanya hizo vitu zote, unaenda, unameza madawa zako venye unaambiwa, unaenda kwa clinic vizuri. You need to stay near hospital or have a proper means of transport to your nearest hospital. Because we expect that complications may arise, and in cases where they happen, we should be in such a way that tunaweza fika hospitali haraka sana. In short, any condition ukiona any signs, any early signs, don't ignore. Just visit your nearest healthcare facility.
So with that in-depth information about high blood pressure in pregnancy, we are going to take our first commercial break. When we come back, we are going to dwell on preventive measures and maybe where you can get help. And there are people who normally, maybe if they get this high blood pressure in pregnancy, they are worried whether they'll have a chronic hypertension post that. I think Dr. will come and clear the air on the issues of post-pregnancy. And I think that's it. And this show is normally sponsored by Nyaluk Foundation. Nyaluk Foundation is a local NGO which deals with the sexual and reproductive health, mental health, environment, and health. And the Nyaluk Foundation is located in Nasha Plaza, first floor. And if you know somebody who has this condition, Nyaluk Foundation also have a medical clinic at the same place where you can always come and get assisted. We'll get our doctors there, our professionals who will guide you, not only on medication part of it, and also the counseling bit of it, because it's a very traumatizing condition, and people get worried on the outcome of the condition. So, if you know somebody who has this condition, kindly don't panic. It's something which is very manageable, and you live a normal life. Thank you, and see you after the break.
Eaglemount Academy is a private Christian-based institution located in White House Estate along the Nakuru-Solai Road in Nakuru County. We believe in prayer, smart work, discipline, and excellence. We mentor, nurture, and transform our learners into responsible young people in the community. In Eaglemount Academy, we offer education on a holistic level from daycare, ECE, lower primary, upper primary, up to junior secondary. The teachers are highly qualified and competent and give the parental love needed to the learners. In Eaglemount Academy, we offer computer classes and also integrate ICT in our learning in order to cope with the modern day technology. We offer French as a foreign language in order to help our learners link with other learners across the globe. We have invested in co-curricular activities in order to help our learners to be physically and mentally fit. We offer a variety of sporting activities such as football, volleyball, netball, swimming, and chess. We have club activities such as scouting, music and drama, wildlife, guidance and counseling, and 4K, which offer the learners with an opportunity to think critically and gain necessary skills for day-to-day living. Safety being our priority, our classes are spacious, well ventilated, and have adequate lighting. Nutrition being important for learning, we offer a highly nutritious, healthy, and balanced diet. Eaglemount Academy, we are pride. Persistent, responsible, independent, dedicated to excellence. Our slogan is, "We are the best." For more information, you can contact the office through 01 12 40 3750 or 07 43 94 8636, or email us on imaknax@gmail.com.
Welcome back, our viewers. We continue with the show. We are discussing today on hypertension in pregnancy. It's a very common condition, and we know there are so many people who suffer from it. And today we are just here maybe to shed some light on it and to tell you that it's a condition which is very manageable, and if you have such like issues, you need to be consistent with your antenatal visits, and your doctor will definitely help you sail through it, and you'll be well. So the show is sponsored by Nyaluk Foundation, and this show is called Afya Yetu. We need to know our health. You need to know where to go to when we have these conditions, and we need to know how to mitigate and prevent this health condition. That's why we are here, to give you some information on your health. And today I have with me Dr. Salvan, which is very resourceful in shedding lights on these conditions. And today, as we proceed, I just want to maybe Daktari to tell us maybe when you have this condition, which kind of tests will you be requested in the hospital, and maybe what to look out for in those tests. Maybe you can be told, maybe we want your urine, we want your blood, we want to take a cholesterol level, we want to know your liver, your kidneys. Why do they ask us for these tests, and what are normally the results, and things like that, Daktari? Yes.
Asante sana. To our viewers, welcome back. As you said, I'm Dr. Kengo Salvan. I'm always excited to be the viewers in this health talk of Afya Yetu. Yes, I also double up as a community health advocate under CBO by the name Vimeo. Yeah, the one I'm donning here. Vimeo deals with community health promotion, community health empowerment. We organize outreach activities and try to teach people about matters health, so that we can try to mitigate and prevent these common conditions that could be life-threatening. Yes, that is why today I'm more than privileged to be talking about HTN in pregnancy, since this information can help somebody somewhere who is watching us today. Yeah, so Dr. has asked a very important question here. What common tests are usually done to our hypertensive patients or to those we suspect are hypertensive? I think the baseline one usually is the BP test, the blood pressure machine test. That will be the surest way to know that one is hypertensive. Yes, Dr.
Yeah, so when you are checked BP and the way you've told us that there are normal ranges of blood pressure, so when you are told that you have this high blood pressure in pregnancy, your BPs will be at the roof, and after that they'll request they take your urine. Normally they want to do urinalysis, look at proteins in urine, and if you have proteins in urine is another issue altogether. Then after that they'll ask maybe for kidney function test, liver function test, because one of the complications, as Dr. has said, that this condition can give you something called HELP syndrome, where it goes and affects your liver, your kidneys, and things like that. And normally it complicates. At times it gets so worse that people get convulsions in pregnancy, what Dr. is called eclampsia, which is normally a severe form of it, and we normally don't want to get there. And there are some treatment medications and preventive measures which are normally taken before you get there. So this is why we are advocating and we are highly advising you that the moment you are diagnosed with the high blood pressure in pregnancy, you are advised to be at the hospital. Make a friend with the hospital, because if these complications arises, we'll be speaking a different language. And us as medics we like more of prevention than treating. So normally we look out of these conditions and we prevent them beforehand, before they happen, because we don't want to get there. So Daktari, we know right now we have a lot of issues with the health insurance and out-of-pocket payment towards the healthcare and things like that. So I don't know, when somebody has this condition, where can they go? How can they get assisted? And is there a way that this condition is covered under SHA, under health insurance? Let's talk about SHA to be specific, because we are told that around 18 million people are registered and only 3.5 million people are paying, and people get a lot of issues with the SHA payment and what have you. And even as per yesterday, we were told RUFA is withdrawing from SHA, and their facilities will not be offering services under SHA from Monday next week. And they offer services up to 30% of the population. That's a huge number. So Dr. I just want you maybe to expound and make our viewers understand where they can look for these services and the SHA thing, because SHA goes hand in hand in every healthcare. Yes.
Thank you very much, Dr. Yes, we have our issues with insurance, with SHA. Yeah, the last time I checked, SHA had incorporated a maternal care plan, what looked like what we formerly used to refer to as Linda Mama. Yes, SHA had a similar plan, and for some times, really, it was working. That cared for the delivery package, and I think even during the puerperal period, that is postpartum, it covered for the conditions that arise till about 6 weeks, I think. Yeah. The challenges with SHA technologically keep coming, really, regardless of whether we are in the maternal side or in other sides of hospitali. And as it stands, we really hope that things can be streamlined and we can have a functional, more optimized, and an insurance that fully serves the people. I hope they're going to work on it and finally make our patients feel treated and be treated. Yeah, but on the package about maternal care plan, really, yeah, Sha had it. What looked like Linda Mama. Yeah, and for those who admitted it did work on the days that it was working, but on the days that it had problems, we had these challenges.
Yes. We know the issue of SHA shift normally comes in mostly with outpatient, because the capitation for outpatient is so low, and these are people which we don't want even to we don't want to admit them, because a mother is somebody who, when you admit the mother, they have a lot of other things which they are taking care of. They're taking care of their husbands, they're taking care of other children, they're taking care of the community, you see. So if we have a dysfunctional maybe health insurance at outpatient level, or Linda Mama, because there's a very little capitation on it, so we are in problem. But as we work on our SHA thing, we hope that it will be resolved and things will start working on well. And what I want to assure our viewers is that this condition is not even difficult to manage, by the way. And even the drugs are not that expensive. I think Dr. can testify to that. The drugs are not that expensive. So don't get this condition and think maybe it's a life and death sentence or what have you. But the drugs are very cheap and they're readily available. And the problem only comes in when you default these drugs and you start getting complications. Yes. I think Daktari now, maybe if you can tell us, maybe this is a very young lady, maybe in her 20s, she gotten pregnant, and they told her that she has high blood pressure in pregnancy. What happens after the delivery?
Thank you very much, Doctor. The question is appropriate. When you get hypertension during pregnancy, as we had said, we have a lot of variations when it comes to the terms we give to hypertension in pregnancy. It can either be gestational hypertension, it can either be chronic hypertension, it can either be preeclampsia or eclampsia. Depending on whatever you are dealing with. For example, gestational hypertension simply means the high blood pressure you are talking about was somehow just restricted to the gestational period. Meaning baada ya kuzaa tu hivi immediately, maybe days after it or 1 week after it, the pressure normalizes na tamekuwa sawa. For chronic hypertension, huyu ni mtu amekuwa na hypertension, inaweza kuwa ilianza before pregnancy, ika proceed all through pregnancy, then even after pregnancy, ika proceed 12 weeks after pregnancy. That is, we're talking about high BPs that try to be controlled as in a under medication. So, the main point here is we have high blood pressure that can remain restricted within the gestational period. Then we have another form of high BPs that can proceed beyond even 12 weeks after delivery. Now, this is what we call chronic hypertension. From those two particular stats, what I'm trying to point out is, after delivery, do not assume that now the hypertension came due to the pregnancy, na venye umezaa sasa, it's going to automatically disappear on its own. There's a it's very vital to keep on monitoring your BPs even after pregnancy, so that you can tell exactly, or you can find out whether your hypertension was restricted to the gestational period ama ilipita after that. Na kama ilipita, you can continue with the treatment. Still post-delivery, as I said, we have maternal complications that can come with it. I talked about the fetal complications. But one of the commonest, as I said, is very high volumes of bleeding during pregnancy. So these are complications that we do expect, and for an hypertensive mother, you have to be cautious. We have to be anticipatory when it comes to these things, so that it doesn't come as a surprise. Still, during puerperial period, for a form of hypertension that is complicated, something like preeclampsia, the data says we see a very high rise of complications from preeclampsia to eclampsia during puerperium. Puerperium, I mean during the postpartum period. So the whole point is hypertension will occur during pregnancy. This hypertension can still proceed beyond pregnancy. And then hypertension can be quiescent, it can be silent, it can be docile during pregnancy, it's quite a major complications. But during puerperial period still, that is ukishaza, tunakuwa na some serious complications arising still from the hypertension. So the message is, the moment umeza, don't assume that your hypertensive problems inaenda nayo. In some cases it might. But in many other cases, we have complications that arise after that. And the only sure way of dealing with them ni, tafadhali continue with your hospital visits, continue with your BP monitoring, at least 6 to 12 weeks after delivery.
And Daktari, I see there are some few concerns here. And just before I read the concerns, I just want to reiterate that this is Afya Yetu TV program, which normally runs every Friday in the morning. And Afya Yetu is sponsored by Nyaluk Foundation. Nyaluk Foundation is a local NGO which deals with sexual and reproductive health, mental health, and environment and health. And today we are talking about high blood pressure in pregnancy. So there's a lady by the name Vivian. She's asking, what are the modalities of delivery when you have this high blood pressure in pregnancy? So how will this person deliver like childbirth process? Will it be a cesarean section? Will it be a normal delivery? Yes, maybe you can expound on that.
Asante sana. You said the lady's name was?
Vivian.
Oh, Vivian.
Yes.
Thank you, Vivian, for keeping in tune with us. And we're proud that you're watching and actually asking questions. Asante sana. So, Vivian, when it comes to the modalities of delivery, we have two modalities of delivery, usually. Let me not say two main, because
there's no third one.
Because there's no third one. So it can either be the normal vaginal delivery, or we can have the cesarean section, whereby you make an abdominal incision and a uterine incision so that you can get the baby out. This delivery, when it comes to hypertension, will depend on various factors. It will depend on the status of the baby. It will depend on the status of the mother. It will depend on the complications that we are seeing at that moment, that will determine whether we are going cesarean or we are going normal vaginal delivery. When everything is controlled, when the status of the mother is okay, the fetal-maternal well-being is excellent, we always try to deliver normally. The message is, having hypertension during pregnancy is not a warranty that now you have to go through cesarean sections. But it does give a very high chance. It does predispose you to a very high chance of doing a cesarean section. depending on the things I said. How is the fetus? How is the mother? What complications are we seeing? If everything was okay, we do our test, and all of a sudden we realize that the fetus is not hayuko sawa. Tunaangalia fetal heart rate imepanda juu sana. It means things are not okay. And such a delivery, you need to expedite it na mtoto azaliwe. When that happens now, lazima tu literally wacha niseme tungoe mtoto, tutafanya CS. But when you control everything, tunapima kila kitu iko sawa, we can actually try normal delivery. So it does give a high chance of going through CS, but it's not a final testament that when this happens, we cannot do vaginal delivery.
Then there's another question here by Chelangat. She's asking, what are the preventive measures when you present with the high blood pressure in pregnancy? What are the preventive measures that it doesn't recur again in your subsequent pregnancies?
The preventive measures of hypertension, most of them, the good thing is that most of them are actually doable and self-done, that is. There are the risk factors that we talked about initially. Alcohol, smoking. We talked about obesity, that is diet. We talked about, obesity, that is hyperlipidemia. We do call this modifiable risk factors. Modifiable means it's something that you can modify, something that you can change. You can definitely change your diet. You can definitely work on ways to lose your weight. It's very possible to stop drinking alcohol. And it's also very possible to stop smoking. Those are what we call the modifiable risk factors. Those we can modify. Those we can work around. Those we can kick them out so that we can reduce our risk for hypertension. Then we have the non-modifiable risk factors now. The other things we talked about, like now your age, the family history, genetics. For such cases, usually when we make a diagnosis of hypertension, we try our best to try and link it to some risk factors so that just apart from treating it, we can try and prevent it or prevent the things that led to it. So when you have factors that you cannot modify, something like genetics, the best way possible is full compliance to the medications that you are given. I know it can be a tedious process because the moment we find maybe the risk factor you're dealing with there is family history or probably genetics, it means you have to go through a long-term treatment plan. Nida utakuna meza kila siku na kila siku tutahitaji ufanye your BP monitoring, that is when you are at home. So ununue the BP machine, you have it at home. You keep checking your BPs at least twice a day. And it's a long and tedious process, but when there are risk factors that we can't modify, the major thing is we try to be compliant as much as possible to the medications. Because the good thing rather with hypertension is when it's controlled, it doesn't give us much problem. And control is through medications. But when it's uncontrolled, now you have a whole barrage of problems setting in. Yes, and for the subsequent pregnancy for Chelang, and in this case, we said a previous history of hypertension in pregnancy is a very big risk factor for hypertension again in subsequent pregnancy. So the major thing in that case is control, and we attend the visits, clearly stating the history we've had before when delivering the previous baby.
So, I think at this point we are coming to the tail end of this discussion. And I think there's one more question which we'll tackle as we end the conversation. And there's Peter Maina who asked that her wife alikuwa na molar pregnancy, then akapata high blood pressure. So hakuwa anaelewa the relationship and how molar pregnancy ilifanya bibi yake akakuwa na high blood pressure in pregnancy. I think that's the last question which we'll be taking, then we end the show for today.
Asante sana. We are ending the show with maswali moto.
Sure, that's so
I'm actually impressive that you said the guy is called
Peter.
The guy is called Peter.
The wife in that respect. The wife got molar pregnancy, and in that respect, she was diagnosed with the high blood pressure in pregnancy. So he wanted to know what is the relationship.
I'm actually impressed that Peter did follow up and even came to know the term smaller. Unajua wazee wakiendanga hizi clinic na kuzaa, yeye ako hapo nje tu anangojea mtoto amezaa ko sawa. Ilikuwa nini? Daktari amesema iko haya sawa. Hata jina
hata date of delivery. Akishatoka hapo hivyo anasahau kila kitu.
There's this joke we make about that Zarana birthday. Kijana leo ni birthday yako. Uko class ngapi? Unaelekea 7 sasa hii. Ay. So for the guy really to take in interest in the specific condition that the wife had, that is impressive. That is interesting. Really, when we dig into medical literature, specifically on the correlation between molar pregnancy and hypertension, I think let me not get medical. The causes, the causes of these two conditions are a little bit different. And while really we can have a correlation, some percentage of it, but the causative mechanism, so what I explained the other time, how the hypertension comes about and how we get to have molar pregnancy can be a little bit varied. And we can't clearly pinpoint that specific causes of molar pregnancy is what attributed the lady to having hypertension during pregnancy. It's not one of the key risk factors of having hypertension during pregnancy.
Yeah.
It's just one of the cases whereby you have comorbids.
Yeah.
One of the cases where tumbo inauma na kichwa inauma.
Yes.
We can have conditions that inaweza kuwa na tumbo kuuma na kichwa kuuma.
Yeah.
But it doesn't mean that kichwa kuuma tumbo itauma automatically.
Yeah, sure.
Yeah.
So as we come to the tail end of this show, I think there are some key areas I want to highlight on. The message which should go out there is this condition is it's a manageable condition, and some of the things which we need to take care of, one is to control the blood pressure and to prevent hypertension, to prevent complications. So if you have this condition, like for example, if you have high blood pressure pre-pregnancy, uko na shida ya pressure kama hujapata mtoto, then upate mtoto, the moment realize that you are pregnant, the very first time you realize that you are pregnant and you are normally hypertensive on drugs, kindly please visit your hospital ASAP, because some of the drugs which we use when you're not pregnant are not used when you are pregnant. So if you are normally hypertensive and you've gotten pregnant, kindly visit your hospital as fast as possible, because some of the drugs are teratogenics, as in zinaweza pea mtoto shida, complications. So you need to visit your hospital, and the drugs will be changed to the drugs which are friendly to the baby. So we want to end this show at this point, and it's always our pleasure to give you this information, and you can always join us through our social media platform. And if you want to be part of this show, kindly reach out. Maybe you have a testimony to give, you want to give us some insight, how you are managed, things like that. And this show is sponsored by Nyaluk Foundation. Thank you so much. See you next week on Friday, same time, same place.